Hi, everyone. Welcome to the very first International Sickle Cell Perspectives Facebook Live event. I'm really glad to be partnering with Novartis on this broadcast, which is worldwide. It's actually a true international broadcast to continue a conversation about a debilitating and potentially life-threatening condition, sickle cell disease. I'm Dr. Dave Montgomery. I'm a practicing physician in Atlanta, Georgia, here in the United States, and I'll be hosting our Facebook Live event today. I'm really honored that Novartis included me in this because as a practicing physician, in the past, I've treated patients with sickle cell disease and have seen firsthand the impact that it can have on their lives and the people around them. Interestingly, we're going to have throughout the next hour, we're going to hear from a number of experts, world-class, worldwide experts who are going to tell us not only that they've dedicated their lives to helping treat patients with sickle cell disease, but also forging the research front along to learn more about sickle cell disease and how we can face some of the specific and unique challenges of the sickle cell patient and their families. We are streaming this perspective, Sickle Cell Perspectives panel discussion live, get this, in 4 other languages than the one I'm speaking right now, which makes me very excited: Arabic, French, Portuguese, and Spanish. And all of those translations you can get by phone. You can get all 4 of those by phone. All the details are right under here on the Facebook page. Dial your country's number, then enter the preferred language access code. We want everybody to be a part of this. Truly a global learning environment today. Sickle cell disease, as you may already know, disproportionately affects people of African ancestry. But you may not know that it's also seen in different populations around the world. And that's why we're hosting this event today on what is also known as World Sickle Cell Day. So we're using this World Sickle Cell Day to raise awareness and focus on this potentially debilitating disease, not just in the physical debility that it can cause, but in some of the social and the emotional impact that it can have on the patients and the loved ones, no matter where you are in the world, as it turns out. Thank you to all of those who have already started to send your questions down here in the comments box. If you've got new ones, put those in there too. If you're thinking about one, go ahead and give it a shot. Put a comment or a question down in the box. We'll get to those a little bit later. So I'm going to have some questions for our panelists, of course, but the most important questions come from you, people out there who want to know more about sickle cell disease and the people in the sickle cell disease community. A couple of housekeeping notes. We have to have these, of course. We'll do our best to answer as many of the questions as possible. Keep them coming, but we have a limited time so that we may not be able to get to all of them. We would like to narrow the focus and keep all of the questions about sickle cell disease. And here's the second to last, and really important comment. The conversation that we're going to have should not be a substitute for getting medical advice, personal medical advice from your healthcare provider. We unfortunately are not going to be able to discuss specific medications or treatment options for you. We're going to send you to your care providers. So I'm going to do my best, lastly, to pronounce everybody's name as properly as I can. But remember, this is truly international. So there are going to be some names from places that I may not pronounce properly. Give me a break. Forgive me in advance, okay? What I'd like to do is stop jabbering along here and get started with our very first guest on the Sickle Cell Perspectives live chat today. Her name is Dr. Baree Andemariam, and she is a hematologist and associate professor of medicine at the University of Connecticut Health Center. She founded the Adult Sickle Cell Center in the New England Sickle Cell Institute. She's also the chief medical officer for the Sickle Cell Disease Association of America. She is actually from Eritrea in Africa and has spent some time in the hospitals there as well. So her perspective is broad, not just here in the United States, but having perspective in Eritrea as well. So Dr. Andemariam, thanks for joining us on the Perspectives today. What I would love to do is set the stage for everybody here and tell us what is sickle cell disease and then what happens to patients when they develop.
Living with it, right. Thank you, Dr. Dave. Yeah. So sickle cell disease is actually one of the most common blood disorders, inherited blood disorders worldwide. We think of it as being relatively rare, but it's actually very common if you look at the global incidence. We know that 300,000 babies are estimated to be born with sickle cell disease around the globe every year. about 100,000 Americans live with sickle cell disease. Yeah. It's a disease that you inherit. It is a disorder of the red blood cells. And as people might know, red blood cells carry a substance called hemoglobin. And hemoglobin is the molecule responsible for carrying oxygen and transporting it around the circulation so that it can be delivered to all the organs, so that all of the vital organs can carry out their necessary function. Mm-hmm. But when you inherit sickle cell disease, you inherit a different copy of that hemoglobin gene. And so instead of the red blood cells being plump and round and easily deformable and mm-hmm. able to get through the circulation well, the people who inherit sickle cell disease have an abnormal shape to their red blood cells, a so-called sickled shape. And you can imagine that change in shape can make it harder for the cells to get through circulation.
Yeah, especially those small capillaries. Yeah.
And so they can get stuck. Yeah. It's a process called vaso-occlusion. And that process gives rise to some of the major manifestations of the disease, which include episodes of severe bodily pain that come out of nowhere, sort of like having a heart attack all over your body, like stroke. In fact, it's one of the leading causes of stroke in children.
So children can have stroke with sickle cell disease?
With sickle cell disease,
wow.
Absolutely. And it also decreases the immune response. So people are relatively immune suppressed. So they're more susceptible to common infections and life-threatening infections.
Yeah. So that's interesting how a red blood cell abnormality mm-hmm. can lead to infections. We're going to talk a little bit more about that later with one of our other experts. What are some of the symptoms that the patients get? Are they just pain anywhere, or is it in specific organs?
It can be pain anywhere, any region of the body. Commonly, patients that I see will describe their pain as being in their low back, in their chest, in their extremities, but it can be anywhere. People can even have a painful event, as we call them, in their spleen. Their spleen can get really large, and that's a major cause of morbidity, particularly in children, where a lot of the blood can pool in the spleen. The spleen gets really big, and that can cause a life-threatening situation. Other symptoms, common symptoms, are fatigue, because these individuals are relatively anemic because their red blood cells are fragile. They don't live as long, so they're anemic, they're tired. And when the red blood cells break open because they're so fragile, they can release a substance that has a yellow pigment. So oftentimes they'll have yellowing of the whites of the eyes, something that we call jaundice. Mm-hmm. So those are some of the features that you might see or experience with sickle cell disease.
You can't necessarily, aside from those visible signs, right? Jaundice isn't necessarily a sign of sickle cell disease, but certainly in cases where they have a lot of that being released into the blood, they can get jaundice.
Exactly.
You can't see the pain, though. You can't see the manifestations. You can't test for sickle cell disease, is my understanding. Is that true?
You can. There are blood tests that can be done, absolutely. But you're right. The symptoms are, you have to believe the patient in front of you. You have to believe their pain. You have to believe their fatigue level. There's not always a correlation between how severe the anemia is and how bad their pain is. Yeah. So it really is, you're absolutely right. Someone can be living with sickle cell disease, you'd never know it. Particularly because one day they're feeling really well, and the next day one of these painful events can occur, which lands them into the hospital or in front of a medical provider, or sometimes people really try to tough it out in bed at home.
Yeah. Many medical providers don't understand sickle cell disease either, to your point. And you have to believe a patient who comes in, because I can't run a CAT scan to verify that you're having pain in one of these places if you're having a pain crisis.
Absolutely not. You're right. You're right. You have to believe the patient. This is what we're taught in medical school. Yeah. But somehow when physicians and nurses are in the context of a patient with sickle cell disease, they forget that you're supposed to always listen to the patient. And I think a lot of that has to do with the hallmark of the disease being pain, and pain being something that is so subjective and not measurable. That there aren't that many illnesses described in which the main symptom is so subjective.
Yeah, and potentially so severe.
Exactly.
Yeah. So thank you, Dr. Andemariam. She's starting us off today on our perspectives. Now I want you to meet who actually is in Stockholm right now, Professor Miguel Aboud. He's a practicing pediatric hematologist and the chairman of the Department of Pediatrics and Adolescent Medicine at the American University of Beirut Medical Center there in Lebanon. He also specializes in sickle cell disease. Professor Aboud, welcome from Stockholm.
Thank you. Thank you.
Welcome
I'm very
from New
glad
York,
to be
but
on
you're
this
in
panel.
Stockholm. Yes. What I'd like for you to do is actually tell us how patients with sickle cell disease are diagnosed.
Well, in many countries of the world, including the United States and many European countries, patients are diagnosed at birth through newborn screening. It's a blood test done, on newborn babies, and the test gets done through something called the hemoglobin electrophoresis. It might not actually be an electrophoresis, but it's a test that will show you the different types of hemoglobins in the blood. And patients with sickle cell disease have a majority of sickle hemoglobin, regardless of whatever else they might have, depending on the different syndromes. And in most of the developed countries, including the United States, many European countries, as I mentioned, in Brazil, in many states, this test is done at birth. So babies can be diagnosed at birth and taken care of. In other parts of the world, where sickle cell disease is prevalent, including many countries in the Middle East and Africa, one usually awaits until there is some sort of manifestation, be it pain, anemia, or something else, in order to run the blood test to diagnose the disease. And this could lead to significant delays. And we know that patients who are diagnosed at birth fare better. They do better than patients who are diagnosed later on in life. So essentially, it's a simple blood test, preferably performed at birth. It's a part of newborn screening in many countries, but in the countries where the vast majority of sickle cell patients are born, be it Africa, the Middle East, and so forth, the test is not done at birth, and one has to wait until the patient shows up with some kind of symptom.
So for those of you who are just joining us right now, we are live doing a Sickle Cell Perspectives live Facebook chat here with a number of experts from across the globe. This is an international forum that we're doing here, and we're actually going to be later talking to a patient who's living and thriving with sickle cell disease. We want you to participate in this, though. We want you to add your questions and comments on the bottom, and a little bit later in the program, we're actually going to be taking some of those very important questions. I'm talking right now with Professor Aboud, who is currently in Stockholm, Sweden, but practices and lives in Beirut, Lebanon. Dr. Aboud, Professor Aboud, you mentioned that people who are diagnosed early in life do better than those who are diagnosed later. Do we know why that is?
Oh, yes, there's a number of reasons. The key to sickle cell, to improving survival in sickle cell disease at this point in time is providing comprehensive care so that we can prevent damage to organs in the body. Now, in particular, there is a high risk of infection in the first year or two of life. And in the first year or two, pain is usually not very evident. So babies with sickle cell disease might die because of an infection before they ever develop any significant pain crisis. Also, they might have what my good friend Beri mentioned, enlargement of the spleen. And the spleen can get very large, and this can be very life-threatening. And we know, for example, that teaching parents to recognize a sudden enlargement of the spleen can be life-saving for many, many children. So infections, looking at splenic sequestration, and generally have children brought to care early on so that problems with sickle cell disease can be prevented. And again, since this is a lifelong disease, it's an important educational process for the parents, obviously later on for the patients and for the healthcare providers, which the earlier one starts with this process, the more one knows about the disease, the better off the outcomes are. And this is not just a hypothetical situation. There is data to show that children diagnosed in the newborn period actually have better survival, and I would venture to say better quality of life and longevity compared to children who are diagnosed later on in life. And again, the pain is not usually evident very early on, but it becomes manifest later on in life. That's not to say that young children cannot have pain. They may. Swelling of the hand and feet, dactylitis can happen very early on, but you can just have a child who one day develops a fever, has a problem with a pneumococcal infection, and unbeknownst to the parent, that child had sickle cell disease and does not do well.
Yeah. So you bring up a really important point that I think is a theme across medicine. Early detection is a part of prevention. Early detection saves lives. Professor Aboud, thank you so much. Now I want to bring in all the way from Sao Paulo, Brazil, Dr. Maramia Pita, who is a pediatric hematologist at Hospital Samaritano and the founder of Sickle Cell Disease Pediatrics in Sao Paulo, Brazil. She also founded the pediatric committee of the Brazilian Association of Hematology and Hemotherapy. She's also the creator of something called the Red Moon Organization, which we're going to hear about in Brazil. Dr. Pita, very nice to have you all the way from Brazil. Let me ask you this question. In Brazil, because what the panelists have talked about so far are the manifestations, but they also have alluded to the problems that come with it. Are there support networks for sickle cell disease patients there in Brazil?
Well, first of all, I'd like to thank you for inviting me to this event, because I'm sure it will raise attention not only for sickle cell disease patients and their families, but also among health professionals, caregivers, and the general population. Red Moon Organization is here in Brazil, the first to have a network support for patients. As you all know, sickle cell disease is one of the biggest healthcare challenges around the world, based on data from World Health Organization and UNESCO. Here in Brazil, because we have a very diverse population, sickle cell disease can be diagnosed among Afro-descendants or among people from other races. We have about 3,500 sickle cell disease patients, new cases per year, and the highest incidence is in the northeast part of the country, in the state of Bahia, where we have one sickle cell disease new case for every 650 live births. So we estimate about 100,000 patients with sickle cell disease in our country. And we are here today to tell you how we have been dealing with this large number of patients in a developed country and a continent one. To face these challenges, we created the Red Moon Organization.
Yeah. So the Red Moon Organization, really important organization, and we're really happy that you are doing this very important work. Does the Red Moon Association really help patients with the emotional parts of coping with the disease and the family members, right? The emotional, the social parts of the disease?
Well, in fact, it depends on the social context of each patient. Brazil is very diverse, and most sickle cell disease patients are in the Northeast region, which is also the poorest part of the country. Neonatal screening is done in about 8% of the population. The presence of S hemoglobin should direct the patient to a sickle cell disease specialized center. Brazil, unfortunately, don't have enough centers, so sickle cell disease patients don't have access to proper treatment, and their families lack information about their condition. Children grow up with wrong concepts about sickle cell disease, losing the opportunity to raise awareness about the disease. If people understood sickle cell disease better, they could embrace the cause and promote better social inclusion for patients, which would lead to better quality of life. And to improve the relationship between patients and healthcare professionals, Red Moon created a digital campaign to bring awareness to sickle cell disease, since it's the fastest and easiest way to reach sickle cell disease patients, families, healthcare professionals, and the general population. With social media such as Facebook, Twitter, and others, patients can connect and exchange experience, and it motivate one another, improving their own health. We believe that a positive emotional journey is the key to a successful treatment.
Yeah. That is a really, really good point. We're going to hear more about positive emotional journeys and success with sickle cell disease later in our program with a patient here on our panel. Thank you for all the work that you do, Dr. Pita, there in Sao Paulo, Brazil. Now I want to keep going around the globe here. We're going to be talking next to another one of our experts, Dr. Vinay Tubman, who is a pediatric hematologist and assistant professor of pediatrics at Texas Children's Hospital and Baylor College of Medicine in Houston, Texas, here in the United States. For over a decade, Dr. Tubman has been going back and forth, working extensively in Africa, in Liberia, and in Tanzania. Not only taking care of patients there, she says 3 months a year, but also helping the care providers there learn the best practices of sickle cell disease management and helping train some of the physicians there. Her research focuses on the impact of infections. We've talked about that a little bit today for these children, right? That's where her research is rooted. Dr. Tubman, thank you for being here with us. Let me ask you if the experience, because we've kind of heard about some different experiences here, if the experience in those African countries is different than the experience here in the United States.
Sure. First, let me just begin by thanking you for having me on this panel. I'm so grateful to share this space with such amazing, inspiring people. And I also really want to take an opportunity to recognize the colleagues that I work with in Liberia and Tanzania, in Uganda, in Malawi, who are really doing this work, because in a lot of ways, the experience of having sickle cell and treating patients with sickle cell disease is very similar in the United States, and it's also very, very different between the United States and sub-Saharan Africa. We've heard already about the importance of early diagnosis and how that really affords us the opportunity to intervene on this disease early and to really save lives. Unfortunately, in a lot of countries in sub-Saharan Africa, that's not widely available. And so we have disturbingly high rates of early mortality in many countries in sub-Saharan Africa, such that up to 90% of children with sickle cell disease in sub-Saharan Africa don't survive until beyond age 5.
90% of these children do not survive past age 5.
Yes.
Yeah.
And it's tragic. As Dr. Aboud alluded to, what we see with these children is that they come in with infections, and we simply don't know that the reason their infection is worse than somebody else's is because of their underlying sickle cell. Without the opportunity to make that diagnosis, we often miss it.
Wow.
Because of that, I think the battle that we're fighting in the United States is one of improving the quality of life, whereas in sub-Saharan Africa, we're really trying to improve quantity of life.
Past 5.
Past 5.
Yeah.
We can do better.
Yeah.
So I think we can really use our resources, particularly by raising awareness amongst physicians, raising awareness amongst families, employing tools like it sounds like Red Moon is doing to build a social community for families that can really empower them to fight this disease and to learn more about this disease and to advocate for themselves.
Yeah. I mean, you talk about an emotional impact. I can't imagine that many families saying goodbye to a 3, 4, 5-year-old child, and it's happening in the hundreds of thousands?
Absolutely. We heard that about 300,000 children are born with sickle cell disease every year, and about 75% of that 300,000 occurs in sub-Saharan Africa.
Right.
So this number of patients is huge. And then we do have some patients who will survive beyond that. And we haven't yet employed all of the strategies that we can employ in sub-Saharan Africa to provide good care for those children and young adults, to ensure that their pain is well controlled, to ensure that they're not occurring other complications such as strokes and all of the other organ damage that can occur with sickle cell disease.
And the infections, which sounds like from what Dr. Boot is saying and you're echoing, is what really is a problem very early in life and probably plays a role in their deaths.
Absolutely. You mentioned earlier that sickle cell disease is a disorder of the red blood cells, but because those red blood cells sort of get log jammed in these small blood vessels, it really creates a systemic inflammatory problem in the entire body. And over time, it can begin to affect all parts of the body. And I mean, really knowing this as a parent, knowing this as a child, I can imagine it really is very emotionally stressful throughout life. Yeah. So one of the things that we really have to work on, both in the U.S. and in Africa, is encouraging families and teaching families how to cope with that.
Right. Sure.
Because in very few cases, we've not managed to get rid of the disease in many cases. It's going to be a lifelong disease. We really have to empower our patients and families to manage it and put it in the background as much as they possibly can.
Yeah. No, fantastic work you're doing. For those of you who are just joining, we are doing a Sickle Cell Disease Perspectives Facebook Live event with a distinguished panel from around the globe. This is a truly international group of people who are here to both teach you and give you more information and inspire you about a lesser known, underappreciated, and by all accounts, condition called sickle cell disease. We want you to participate though. So if you have a question about sickle cell disease, if you have questions about where to go for support, we want you to put in a question at the bottom of the Facebook page here and participate in that way. Dr. Tubman, thank you so much for being here, and we'll come back to you a little bit later for more. And now I want you guys to meet Yolanda. Yolanda GB is a very special treat for you today on our panel. She was diagnosed with sickle cell disease before she was born, as it turns out, and is here to talk about what that's like and how she's not becoming the disease, and she's thriving and overcoming the disease. Yolanda, welcome to the panel.
Thank you. So first of all, I would like to thank you for giving me the opportunity to share the voice of the patient here, because I feel that now that scientific and medical knowledge is growing around the disease, what is living with sickle cell disease in real life is not really much known and discussed. So I'm very happy to share my experience of patient and patient advocate with you today.
Yeah, you mentioned that you refuse to be overcome by the disease, but that you can still control it. I can control the disease, but not be overcome by the disease. Talk about what that's like on a day-to-day basis.
Yeah, so being born and raised with a chronic disease, it's kind of challenging, not living the disease, overcoming you and your daily life. So I won't lie, of course, sickle cell disease have a real daily impact on my life, but I'm trying to not let the disease define myself and who I am, and to lead life as normal as possible. With the disease.
And here you are doing fantastic. You're doing fantastic. You went to college?
Yes, so I was born and raised in France, and I had the opportunity to get the best of the treatment possible, I believe. And so I went to university. I achieved a master in public health and in management. Although I know that most of the patients are not able to achieve that because of the impact of the disease. Actually, as a child, I had to deal with interruption imposed by the disease, the many hospitalization and the many hospital visits. But still, I was very supported by my family. Yeah. However, I know that a lot of patients have much more issues to achieve a normal scholarship and then to have a professional career.
Yeah, yeah. I mean, you know, to get through, you know, sort of high school, secondary school, university, and then a master's degree in and of itself, okay?
Yes, it's challenging.
It's challenging, okay?
Yes.
But to do that with a condition that you've got to deal with and contend with on a daily basis means that you had to have support.
Yes.
Some people don't have it, as you said. How important was that support for you going through?
It's very important. So as I said before, I was very supported by my family, and despite I had the disease, they were treating me as a normal patient, and I believe this is a normal person. So I believe this is very important for family who are raising kids with sickle cell disease, to treat them as a normal person, to raise self-confidence in them. This is a key because when you are dealing with such a devastating disease, which can interrupt your life and your scholarity and your work as well, you need to get some support from your family, and you need to be raised in such an environment that you can believe that despite the disease, you can lead a normal life and you can achieve what you want to achieve. So this is very important. And as a patient advocate, I used to tell to the parent that they need to leave their kids as much as possible, leading a normal life, even if I know it's very hard for them. Yeah. But still, it's very important for the adult they will become.
Yeah, to help support. Yeah. Yes. And I think that's a key. Thank you for sharing that. To know that you can live a normal life and achieve what you want to achieve. Achieve what you want to achieve. That's fantastic. Thank you, Yolande, for providing us with that bit of inspiration. We're going to be coming to you more. I'm sure there are going to be plenty of questions for you around that. So it really has been an inspiration, not just hearing from Yolande, but certainly everybody and all the work that you're doing across the world. I'm sure we've got plenty of questions now. I want to start with some of our own as we're getting everybody revved up out there in Facebook Live land, sending us all of your questions and your comments for our distinguished panel. I wanted to just start the conversation or continue the conversation with Dr. Andemariam. So there is a difference between sickle cell trait and sickle cell disease. Tell us what the difference is.
So sickle cell trait means that somebody carries one sickle cell gene that they inherited from one parent and inherited a normal copy from the other parent. So they carry sickle cell trait. There are no manifestations usually of someone having sickle cell trait. There are some exceptions to that rule, but for the most part, individuals with sickle cell trait live a long, healthy life and never necessarily know they have it until they have a child with sickle cell disease. So let's talk about that. So in order for a child to be born with sickle cell disease, they have to have inherited one copy of the sickle cell gene from one parent and another copy of the sickle cell gene from the other parent. So both parents have to have sickle cell trait. And therefore, 1 out of every 4 pregnancies from that couple can result in a baby with sickle cell disease. But just to back up a little bit, because I think it's important, this is piggybacks on what Dr. Aboud was describing with the diagnostic tools that we have. It's important to know that there are other sickle cell-like syndromes where you can inherit the sickle cell gene from one parent and another abnormal hemoglobin gene from another parent, like beta thalassemia trait or C trait. And those combined with the sickle cell gene from the other parent create things like sickle beta thalassemia or SC disease.
So this is a diverse disease. It's not just one disease.
It's not just one disease.
Yeah.
And although the majority of individuals worldwide that have sickle cell disease have SS, or there are substantial numbers of individuals that carry these hybrid sickle cell diseases. And so it's important when you're undergoing diagnostic testing to see if you're a trait carrier, that the physician not only check to see if you have sickle cell trait, but to see if you have one of these other hemoglobin traits. Very important.
Yeah, no, that's really important. Dr. Aboud, I want to ask you this question. Is the syndrome of sickle cell disease different in different parts of the world? In other words, here in the United States, do you get different combinations than you do in different places like Beirut, for example, or in Sao Paulo?
Yeah, well, there are two parts to the answer to that question. In Beirut, we have the majority of our patients have hemoglobin SS, similar to what's the case in the United States. About a quarter of our patients have S with a beta thalassemia gene, which is very common in the Middle Eastern and Mediterranean region. We do not have very many patients with hemoglobin SC disease, which is the case in certain parts of West Africa and is more common in the United States. So from that perspective, it's a little bit different, but it's similar in that the majority of patients have hemoglobin SS. Now, even though the defect in sickle cell disease is exactly the same everywhere in the world, we know that this defect arose independently in different parts of Africa and in the Arabian Peninsula and in the Indian subcontinent. And these we refer to as different types of haplotypes. And these can be quite different, depending what part of Africa people are at. And in the United States, it's a mixture. In Lebanon, for example, the majority of our patients have African haplotypes. In fact, the majority of them are similar to what's the case in Nigeria. In the eastern part of Saudi Arabia, for example, they have the Indian Arab haplotype that has a mixture of another hemoglobin together with the sickle hemoglobin called fetal hemoglobin, which is what babies have while they're in the mother's womb. And that makes the sickle cell disease a little bit less severe in that part of the world. So even though the majority of the patients worldwide have SS disease, these are some variations that can happen. Now, I have to add that regardless of that, and even in the eastern part of Saudi Arabia, where they have high fetal hemoglobin, these patients still experience a significant amount of problems. They do not have a normal lifespan, and they have multiple recurrent problems. It's different from the other haplotypes, even in the western part, for example, of Saudi Arabia or Lebanon or the United States or sub-Saharan Africa. But there is a common thread there that all of these patients have pain, they have lung problems, they have eye problems. Now, the risk of stroke might vary a little bit between regions, but all of them have significant problems throughout life, and all of them require comprehensive medical care, attention to issues like infection. And for all of these patients, I hope that research will yield better treatment soon.
And so, Professor Aboud, to piggyback on that, one of the audience, Facebook Live audience members has also asked if you can elaborate a little bit on what you were talking about now, on what the concerns around heterozygous forms are, was the question from Facebook.
Well, there are two concerns about heterozygous forms. One of them is, as Dr. Marian mentioned, is that people can be misconstrued as not having the disease. For example, somebody who has S beta plus thalassemia, they do have a little bit of normal hemoglobin, and therefore they are usually less severe, but they still, I have many patients with hemoglobin S beta plus thalassemia who are very, very severe. but the diagnosis could be misconstrued. On the other hand, you could have parents who would say, well, I do not have the sickle cell gene. How come my child has sickle cell disease? And we really need to take time and mention it to them. In our part of the world, particularly S-beta 0 thalassemia is identical to hemoglobin SS. S-beta plus thalassemia can be a little bit confusing because we have the same amount, a little bit of normal hemoglobin, a lot less than is the case with sickle cell trait, but still some, and that can be very confusing. But these patients still could have significant clinical problems. With the other types, the hemoglobin SC disease, usually you don't have the same degree of pain crisis or the same risk of stroke, but some patients can have severe pain crisis, even with SC disease. They can have more problems with the eyes, retina, more problems with the hips, and they need a particularly special attention. So I think that in the future, and as we move forward, we need to pay attention to all subtypes of sickle cell disease as we go along.
Yeah, this is a very complex disease. This is a very complex disease, not just sort of the science behind it, which you elaborated on very nicely, but dealing with it. Dr. Pita, I want to go to you about kind of talking about some of the social and emotional parts of things there in Brazil. Are there cultural barriers you are aware of in your region? And actually, that's one of the Facebook Live questions. What are some of the cultural barriers, Dr. Pita, you are aware of in your region of the world?
Well, historically, many people with sickle cell disease in Brazil struggle to afford access to health and social resources. This is a stigma and prejudice associated with the disease. Patients tend to have low self-esteem and believe that they are not able to live a normal life with sickle cell disease. They do not understand that with proper medical care, they can have a normal life and reach old age. They can study, work, have families, and raise children. When we interact with sickle cell disease children, we notice that families lack quality information about the disease. In Brazil, there are good medical centers with multidisciplinary teams to treat sickle cell disease patients, but they are not enough to treat all. And that's why the Red Moon organization was created to provide quality information to patients, caregivers, and the general population, promoting better social inclusion. Inclusion depends on sickle cell disease awareness worldwide, since we are dealing with a genetic condition with high incidence. So if you're able to disseminate information about this disease, we can give these patients better quality of life.
Yeah, no, that's really important work that Red Moon is doing. We've got another question right here for Dr. Tubman. Are there lifestyle changes or healthy habits to prevent sickle cell crises, particularly in countries where they don't have available to them some of the other things?
Sure. Well, one of the challenges with sickle cell disease is that these pain crises are completely unpredictable. We know there are some things that can precipitate pain crises, such as dehydration. That's a big one in sub-Saharan Africa where it can get really hot. Yeah. But dehydration and other illnesses can often precipitate a sickle cell crisis. But there are many sickle cell crises that are just completely unpredictable and catch our patients completely off guard. That said, I think the mainstay of therapy for sickle cell disease is really preventive care. So taking good care of your body. There aren't specific lifestyle changes that I would encourage people to employ, but just taking good care of your body, eating well, using just good health habits, resting well, getting good sleep, trying to minimize or moderate stressors. But I also encourage, particularly for our younger patients, to try and modify their circumstances to make them safe so that they can have a full life. For example, I worked in Boston for a long time where we would get terrible, terrible snowstorms. And, I could always encourage our kids not to play in the snow because cold can really precipitate a pain crisis. But I can also encourage them to put boots two pairs of socks and warmers in your boots,
Right.
and go and be a normal kid.
Yeah.
So I think really encouraging this lifestyle positivity, good self-esteem, good just general healthy habits is key.
Yeah, as Yolande said earlier, you can live a normal life and achieve whatever you want to achieve, and that's really, really key. Yolande, there's a question for you here. It says, do you have any suggestions how people can best support their family members? Not the other way around, right?
Yes.
Family members and friends need support too, and they're saying who have sickle cell disease. So do you have any suggestions about how those people can best support their family members or friends who have sickle cell disease?
Yes, so first, because it's a very complicated disease, as we heard before, I will advise to get informed on the disease. There's plenty of information available on social media, website, internet, and which have been validated by healthcare professionals and available on patient organization website first. Then to be understanding because sickle cell disease is a kind of invisible handicap. So you see me like that, and I don't look like I have a disease or illness, but still I have sickle cell disease. So I believe that when your family member or friend say that he's tired, he has pain, or so on, any kind of symptoms, be understanding and try not to be judgmental, because it's a kind of issue that patients with sickle cell disease are facing a lot, because you cannot see pain, you cannot see tiredness, you cannot see fatigue and very severe fatigue. So this is very hard from the other side to understand what is sickle cell disease like. But still, if you get informed and if you live daily with somebody who has sickle cell disease, you will start by recognizing some of the signs, some of the symptoms, and see that the person is not pretending and is really healed. So, and then, as I mentioned earlier, to be supportive of whatever the patient wants to achieve. For instance, I heard a lot of patients complaining, not complaining, but saying that whenever they were sick or ill at hospital, their family and their parents were very complacent, saying that, okay, you can stay at home, you can rest, and so on, not pushing themselves to go to school. And at the end, it's a big issue. If you don't encourage somebody with such a kind of disease to do stuff by himself, he will have issue as an adult to live a normal life.
Yeah, so that's really, really key information from both sides of the story there. Dr. Anna Miriam, this question is for you. We know a lot of research focuses on quality of life. What are other key areas of research for sickle cell disease?
I think if you talk to adults living with sickle cell disease, and that's who I primarily care for as adults, some of the big issues include chronic pain, and chronic pain being the pain that they live with on almost a daily basis that can't exactly be termed what we were talking about earlier as a pain crisis or an acute pain event, but understanding what causes this switch over time from just having flares of acute pain that come out of nowhere to almost a daily low level of chronic pain that can be very debilitating. It can impair function. You can imagine if you've got a severe headache, how hard is it to think? How hard is it to speak? How hard is it to go to school or raise children, right? So I think that's an area that we need to understand better. I think we also need to understand how this disorder that we know is attributed to a change in the red blood cells causes many problems in many different organs. We need to better understand the problems in the lung, like high blood pressure in the lung called pulmonary hypertension. We need to better understand something called avascular necrosis, which is a breakdown in the joints, like the hips and shoulders, where patients are suffering from chronic pain in those areas and may need hip replacements in their 20s. I think we need to understand better how the organ damage happens. So if there can be research into those areas, I think that that would help the quality as well as the quantity of life.
Yeah, no, those are really, really good points. Dr. Tubman, here's one for you as well. Many countries have specific advocacy groups to provide support for sickle cell disease patients and caregivers. Is there a worldwide group?
That's also a really good question. It's very important that each individual country has its own advocacy group, because there are nuances to how sickle cell disease is perceived in different countries. And I think individual advocacy groups can really, really speak to that. Mm-hmm. I'm not aware of many international advocacy groups, but one organization that I think is important is the Global Sickle Cell Disease Network. This is an organization that evolved within about 5-10 years ago, and is really seeking to bring together providers and patients and advocates for sickle cell disease all over the world.
Global Sickle Cell Disease Network.
Correct.
Global Sickle Cell Disease Network.
Yes.
Okay. All right. So it's very good information. Back to you, Professor Aboud. The question is, what is the well, so this is kind of going back to what we talked about a little bit, but just sort of a little bit of a different take on it. Sickle cell disease versus sickle cell anemia. What's the difference?
There's really, it's a matter of semantics. People usually like to use sickle cell anemia to refer to hemoglobin SS when both genes for hemoglobin are sickle hemoglobin genes, one inherited from each parent, whereas sickle cell disease is usually taken to, to cover the whole spectrum of the disease: SS, S-beta 0 thalassemia, S-beta plus thalassemia, SC, and some of the rarer forms of the disease like SD and SO Arab. So as sickle cell anemia, hemoglobin SS, sickle cell disease, the whole spectrum of syndromes. However, myself and most people, we use, the term sickle cell disease when we're talking about the disorder. I just wanted to clarify that. And just in what Dr. Tubman mentioned about the Global Sickle Cell Disease Network, it's true. And I just have to mention that they have a new website that was just released. And I think it's very important that people check that out.
So there's a new website for the Sickle Cell Disease Network. And
the Global Sickle Cell Disease Network.
Global Sickle Cell Disease Network. Global Sickle Cell Disease Network has a new website. Check that out. Dr. Pita, to you, can you tell us what your pediatric patients experienced growing up with the disease?
Could you please repeat it for me?
What do your patients experience growing up with sickle cell disease?
Well, here in Brazil, we have diverse patients, different patients, and in fact, it depends exactly where the patients are. Most sickle cell disease patients are in the Northeast region, which is also the poorest part of the country. And neonatal screening is done in about 80% of the population. And the presence of S hemoglobin should direct the patients to a sickle cell disease specialized center. But we don't have this enough here, so these patients don't have access to proper treatment, and their families lack information about their condition. Children grow up with wrong concepts about sickle cell disease, losing the opportunity to raise awareness about the disease. If people understood sickle cell disease better, they could embrace the cause and promote better social inclusion for patients, which will lead to better quality of life.
Yeah, so that's a really good point. Dr. Tubman, I wonder if you would answer that from the lens of having, treated patients in Africa. Is it a difference in growing up there?
No, I think what Dr. Pita said is very similar to what happens with our patients in sub-Saharan Africa. I too often hear the story of, a 10-year-old who gets admitted to the hospital, is found to have anemia, and only at that point do we diagnose them with sickle cell. And when you talk to this child, they say, oh yeah, I've had terrible pain for years, and people didn't believe me, people didn't understand what it was coming from. People had a lot of magical thinking or stigma about what was causing me to have pain. Kids, some of these children were not able to fully participate in school and suffered some of the same challenges that Yolande spoke about. So it really is important to not only make the diagnosis early, but to educate people and educate communities about these children, so about sickle cell disease, so that when these children are having these complications, people will associate those things with the disease and lead them to get tested so that they can actually get a diagnosis, as opposed to ostracizing them and really withdrawing social support.
Yeah, it sounds like a great place to start. That would be schools, teaching teachers how to do that. Dr. Endemiram, here's a question for you. How do you deal with depression from related sickle cell disease and sickle cell thalassemia?
So I think what we're identifying more and more is that there is a high degree of depression as well as anxiety, particularly amongst adults with sickle cell disease. Our own work at the University of Connecticut and that of other investigators has shown that association. I think it's important when you are a provider of care for someone living with sickle cell disease, that when you interact with them during their visits, that you not only focus your visit with them on clinical questions like, what's your pain? How's your fatigue level? Have you had a fever? But also to ask about how the rest of their life is going. I always start my discussions actually when I walk into the room with a patient. So how's school?
Yeah, normal stuff.
What was that vacation like that you were supposed to go on? And, how are your children doing? Like that's where we start, because oftentimes that is the greatest issue that patients living with sickle cell disease are dealing with, is how to incorporate the chronic condition, its unpredictable nature, the fear of early mortality, trying to pack in what many of us without sickle cell disease think is going to be 75 or 80 years worth of life into a much shorter time frame. I can't tell you how many of my young adult patients talk about how they want to hurry up and have children and get married and do all these things before the age of 30. And I can't tell you how many of my patients are scared when they're 29 and almost 30. There's this fear that something bad is going to happen, that their best days are behind them. And that's not true. And exactly. I think we as clinicians and we as advocates really have to change that thinking, because I think that's a lot of what leads people into depressive symptoms. The fear, the unknown, the not wanting to disclose. We haven't even gotten into that. Not wanting to disclose that they have sickle cell disease to friends and extended family. The stigma associated with it. And that's burdensome. Can you imagine that degree of burden to be carried by children, teenagers, 12, and young adults? And so I to answer the question, I think the most important way to treat someone with depressive symptoms that has sickle cell disease is to really approach them holistically and understand that there is a whole other part of them that has nothing to do with the disease, and to also include other professionals. In the United States in particular, we rely on social workers with that area of expertise to help us with our patients who may be struggling with certain barriers to their treatment. And we also incorporate psychologists and psychiatrists who are trained in how to diagnose depression and, if necessary, treat it with medication.
And seeing people like Yolande.
Yes, absolutely. And seeing that you can thrive.
Who is, an adult. Can I say your age, or can I just say she's in her 30s? And, if you have the condition and you see people who are living a normal life, but achieving what they want to achieve. I mean, I keep saying that because it was so
Exactly.
key that you said that, then maybe some of this hopelessness goes away.
Exactly.
Yeah.
I might even, if I may even suggest that it's okay to see other people who are struggling similarly to you.
Yeah, right,
And
sure.
to get to
Yeah.
see that other people are struggling and making it through
Right.
as well, and
Yeah.
to support each other within the sickle cell
Yeah,
community.
yeah. So that whole picture of seeing that. And the last question goes to you, Yolande. How did you start conversations about sickle cell disease with your friends?
So it was very hard, actually. It's as a kid, I used to be very impacted by the disease. So I was very often hospitalized for painful crisis and sickle cell disease complications. And as at that time nobody knew what was sickle cell disease, I tend to hide sickle cell disease. So I was not telling my friends or people around me that I had this disease. And even whenever an ambulance was getting me at home to bring me to hospital, I was trying to hide myself under the sheet so that no one of my neighbors will see that I'm going to hospital and I'm having this disease. And then while I grew up, I tend to eat it as well. But something happened when I was in my first year of university. So I didn't tell my friend that I had sickle cell disease. And one day I got a painful crisis and I was hospitalized. And my friend from the university came to visit me. And they were shocked. They were shocked not about the disease, but they were shocked that I haven't told them that I had sickle cell disease. And they were saying, like, how come that you didn't tell us that you were struggling with this disease? And I said, I don't want your look at me to change and to consider me like I am a handicapped person and so on. And the reply they gave me was striking to me. They say, are you kidding? We admire you even more because you are struggling with this disease. And so I understood that in growing up, so because kids are means and they don't know what is a disease or living with a disease, but then growing up, you face more understanding from people. And I mean, clever people, they say, okay, you have this disease, but still you are not this disease, you are what you are, and we like you for that. Mm-hmm. So this is how I started to tell people that I had sickle cell disease. And this is how I get involved in sickle cell disease advocacy activities. And then I became president of local patient group in Marseille, where I'm from. And that I became president of the National Federation of Sickle Cell Disease for 10 years in France.
Wow. That's a great note to end on. You know, that your friend saying, hey, look, we admire you even more now that we know that, hey, the person that you are and what you're achieving in the context of a daily struggle that sickle cell can be, we admire you even more. We admire you on this panel. Thank you all for being here. We're going to bring our Sickle Cell Perspectives Facebook Live broadcast to a close. And I want to thank all of my distinguished guests on the panel from all around the world, Dr. Pita, Dr. Aboud, Dr. Andemariam, Dr. Tubman, and Yolande, who you just heard from. I'd also like to extend a very big thank you to all of you who in the sickle cell disease community have participated with us today, with your questions and your comments, really have sort of helped us get this information across. And a very big special thank you to Novartis for sponsoring us. There's one special note from the American Society of Hematology Sickle Cell Disease Coalition. They just released a powerful public service announcement in recognition of World Sickle Cell Day, which is today, World Sickle Cell Day. We encourage everyone to visit scdcoalition.org. That's scdcoalition.org to watch the full video and share it with as many people as you can. If you'd like to share this discussion, we're going to post that on the Facebook page, and please share and share and share. This is a part of how we're going to spread the news about this condition, teach people and inspire people to be who they can be, as Yolande has told us. Everything you want to be. So we're going to say goodbye for now. Ciao, au revoir, wadin, Goodbye.